Thank you, everybody, for your attending here today, and hello to all our virtual viewers as such. I've been asked to take on this topic largely because in the lead up to this camp, I said this is really important that we get this right, and I offered a view and they said, yeah, that's exactly what we want, you can do it. So putting your head above the parapet is true, Laura, I thoroughly agree with you, but sometimes you do have to be brave and put your head up. I'm going to take you through what is referred to as framing the research question, but I'm going to also focus on the art of framing your research question. There's a very technical piece around the question, but I'd like to draw a little bit more philosophical in this conversation around what are you trying to achieve? What is it all about? And hopefully by the end of the session, you'll have a sense of why the art is so important. So there's a simple consideration. Write a research question, you write it down as a question, and you stick it in, job done. It's never that simple. What I'd like you to think about is a more complex consideration. I'd like you to think about how to develop your sense of inquiry, not just in a single question, but in your entire approach to your research. And apply this to frame the question. So it's not just simply a simple question, it's actually where does this question fit in your learning, your desire to find things out. If you do that, you'll make it in such a way that it's more readily achievable, it generates findings that at the end of the day are more meaningful and allow you to infer and apply these observations that they make a difference. It might even allow you to win the prize at this camp. So I'm going to start with this idea of inquiry. I used this slide first time some years back now at another event, and it's because I feel that research has been somewhat hijacked as a term. You know, people say to me, oh, I don't do research. And I think that's really, really unhelpful. Because research to me is, as it says here, it's a state of mind. It really is something about problem solving. And I defy anybody to be an active clinician or an active scientist and not have that problem-solving mind. Without that, how are you going to go forward? Laura gave you a list of all the problems along the way and all the things she had to solve, but if you don't have that willingness, that sense of inquiry, that urgency to find out, it gets hard. Here are two people that found it very hard. So 18 months ago, Chris and Patrick were challenged by government, what do we do? And if you think about it, it really was when nothing is normal, it's all about extreme uncertainty, and we have no evidence. But government still says, tell me what to do. And if you think about what they were challenged with, you couldn't just go to PubMed, type in COVID, what to do, and expect to get an answer that you can advise government on. And I've just written down 3 of the questions. This is something I've used with some of our students in public health. And we say, well, what information did they need to form a judgment? Was that information available? And what do they do to make a judgment if that isn't available, but they are still expected to stand up there? Remember those awful moments where they stood there, the 3 of them, on a platform, talking to camera, telling people what to do, when in their heart of hearts they knew we didn't have any evidence. And it's only because of this inbuilt agenda in and around critical thinking, reasoning, and then this final task around rhetoric and persuasion. And I'm going to come back to that because I think that is a key part of who we are and what we do. And it's because they were able to think critically, they found a way forward. It wasn't necessarily the right way. My colleagues on intensive care learnt through a lot of failure that there wasn't a right way and they had to reinvent. But it's this flexibility in your thinking. And to me, that sits at the heart of being an active researcher. And there's all sorts of wonderful expressions about what critical thinking is. I like this purposeful or purposive, self-regulatory judgment. And they've got these key words, interpretation, analysis, evaluation, inference. And then this whole explanation piece. Explain it to somebody else so that they can then make a judgment on the words that you offer them. Now, I'm going to encourage you to think philosophically. And if you haven't read Socrates, I encourage you to go and read. There are primers out there. There are simple, well, you don't have to read the whole works of Socrates, but there are some simple principles that he's expounded over, he expounded and have been repeated over the years. And to me, the critical thing is research is all about the Socratic approach or the Socratic method. It's not about doing something and describing what you do. It's about this process of inquiry. And what Socrates said and offered up in various words was this whole question about thinking with clarity and logical consistency. The challenge I have working with people who are preparing applications or people who are trying to get their papers published is the absence of logical consistency. Does it make sense? If you can explain it to your granny, does it make sense? And the danger is we become very confused by language, abbreviations. I mean, some of the cell biology literature I read, I mean, it's alphabet soup and I'll never make sense of it. But there's always a message behind it. And if you can find the message and you can see that clarity, things are easier. The other key thing Socrates said, and I offer this to Walgett, is that authority does not ensure accurate knowledge. Just because somebody's got 4 legs on their chair, or somebody has a title, or somebody is the president of this, that and the other, doesn't necessarily mean they are the font of all wisdom.
I agree with that.
Thank you. But they have an opportunity to help you find the truth. And it's not that you disregard what they say, but you take what they say with caution. Some of the biggest mistakes made in medical literature are because people have used authority to get a paper published. And statements have become embedded in practice because of inappropriate, lack of clear thinking, lack of logical consistency in their argument. And what Socrates offered us was that we should seek the evidence. We should closely examine in the reasoning, and this is this reasoning part, and the assumptions upon which that reasoning is based. All too often, we stick the sentence down and assume that it makes sense, and then get very distressed when it comes back as no. You know, it's about tracing out the implications of what you're saying and about what is said and what is done and how these things hang together. So if you haven't read Socrates, please do so. I'll introduce Aristotle a bit further down the line. And there's plenty of literature out there about reasoning and being clear how reasoning sits. And if you haven't understood any reasoning, please go and look at the literature. And there are 2 main types. There's a third type, which I'm not going to go into, but inductive reasoning very much starts about trying to put a theory to things. And then deductive reasoning is very much about testing that theory. And many of us have to be clear which side of the fence we're sitting on. And very often it's not clear which side of the fence we're sitting on, and it gets conflated. So the first observation to you is please be clear in your reasoning whether you are developing a theory or whether you are testing a theory. Chris and Patrick were left with what was known as abductive reasoning, which is we haven't really got a clue what's going on, but we will take all the information in and make a best guess. But if you're clear in the process that you're in, it's easier to construct your argument. And if you're not used to critical thinking, this is a schematic. I'm not expecting you to read it. It's to remind me to say to you, go and look at the Open University. There's a fabulous resource there about critical thinking and analytical thinking and how to think. And I'm known in Southampton as the person who says, why don't you think about it? Why don't you tell me about it? Why don't you share your thinking? And most junior people are a bit sort of constrained or restricted because they feel like they can't really say something for fear of being found wrong in some way. Don't be afraid. Very often there may not be a right answer, and you may be the person who comes up with an answer that may be right, and you test it and you find out if it is. But please go and look at the Open University page. These slides will be made available later, and we'll provide all the links should you need them. And then we get into metacognition. I'm taking you on a journey today, but philosophically, metacognition is a very simple thing, and it's very much about iterative building. It's not just about doing something once, publishing it, moving on, but it's taking your thinking and building your thinking, and it's a cycle. It goes around and around and around. And people who are senior in their career will tell you that they have explored the same issues time and time and time again, and they still may not know all the answers. But metacognition is this ability to think widely, to think through, to assess, to evaluate, to plan, to apply, and then this is my key word, reflect. And any practitioner should be a reflective practitioner, and in the same way you do it professionally, clinically, you should do it professionally in your research. And my final plea to you is around the precision of language in communication. I'm going to use public health because we have this particular grant scheme we're using while we're here at camp. And precision is everything. So the precise definition of public health is often unclear. It's very much about the art of doing things as much as the science of doing things. And it leads to confusion. And we get words which are imprecise because of ambiguity. The same thing has multiple meanings, we get vagueness, we get equivocation. I'm not here to tell you how to do English, but I am making a plea to you, please be precise in what you say, and when you write it down, make sure it's correct. And by correct, I mean it's not ambiguous, it's not vague, and it's not equivocal. And if you do that, it will make sense to the reader. And effective communication is totally dependent upon precision and clarity of language. And the same Socratic principles apply whether it's your thesis, whether it's a paper, or whether it's a grant application. And I'd even go further and say when you're explaining to your granny. And I'm a great believer, if you haven't got a granny, borrow one, explain it to people. And we're very keen on these 1-minute pitches. Who are you? What do you do? Hi, I'm Steve, I'm a nutritionist, I'm at Southampton. I believe that variability in nutritional state influences your resilience to disease and to treatment. That's who I am. And you should be able to say who you are in one sentence. You should be able to say it in such a way that people say, oh, that's interesting. Tell me more. And I'm a great believer in talking to people outside of your professional group. Otherwise, it becomes a bit incestuous, and we start shorthanding, and we can't afford that. At the end of the day, you need to be able to think critically and apply reasoning, logic, think of Socrates, and you test beliefs. It's about assembling the evidence, it's synthesis and evaluation. And the synthetic processes include contexts, they include refutation. Don't be afraid of being challenged. Many people starting out in their careers feel very uncomfortable standing out and offering something and getting shot down in flames. They're not shooting you down in flames, they're shooting the idea down in flames. It's not personal. And every one of us here who's built our academic career, at the end of our academic career, should we say, have been shot down in flames over the time. And you need to build up that resilience. And the way you need to be very, very clear is to build your philosophical foundations, do your research, read and discuss. And please go away and read. Because otherwise, if all you read are journals, you become very stilted in your thinking. So, let's come to the key bit. How to test and develop your research question. Well, this is my map. I've got a little schematic and I'm going to take you through the map. And hopefully with this in mind, you'll be able to do the things you need to do if you're here on the camp, and you'll be able to use them if you're watching in virtually. So start up here, so I'm going to move across, sorry if the sound goes a little. I'm going to start up here in the top left-hand corner, talking in terms of the area of interest, then a bit of finding out, then loads of ideas, then sifting, how do we take those loads of ideas and trim it down, and then how to frame. And there's lots of techniques you can use. The why, how, what approach is something that we've asked our previous person, Giles Yeo, who gave this talk 2 years ago, I think it was. He talks about the why, how, and what. But I'd like you to think about how you evaluate that research question, how you test it in your own mind, how you develop that into a testable hypothesis, and above all else, developing a persuasive argument. As Woolger has said, it's about your ability to persuade that takes you forward. Your narrative, your storytelling are key. So let's start off in the area of interest. Can I start with all sorts of things might catch your eye or interest you? But think of your clinical experience. For my clinical fellows back in Southampton, I say to them, are you a good doctor, dietitian, whatever? And they say, yeah, I'm very good. I said, do you ever have cases that you feel as though your knowledge lets you down? You don't know what to do. And that sense of not knowing what to do is a very, very powerful stimulus to thinking about what might happen. Think about the knowledge that's out there. Do we really know? COVID-19 was a big black box, but there's a lot of knowledge in SARS. And it was only by that abductive reasoning of going to SARS and other models that we began to think, well, we might know something about this. It might not be the same as what we have dealt with previously, but we can adapt. We're flexible in our thinking. Think about the clinical and research environment you're in. There's no good trying to do something that's in somebody else's place unless you go there. So think about what's near to you and think about collaborators. It is a team effort, and without the team, none of us would actually win. It has to be a team effort, and you have to value and respect what each of the team members bring. So that will stimulate your thinking, and certainly in the what are we now called? PHRP, you have to think about what interests you, and we've chosen public health as a theme because most people here, can I just check, is anybody here from public health? Whichever group you're in, they're going to love you, okay? But my point is, you know, most people here don't know anything about public health, so it's a bit of an abstract thought process for many people, so that's why we've chosen it. Preliminary research, do your homework first. It's much more than Dr. Google. Okay, here you may only have Dr. Google at your fingertips and a bit of PubMed, but don't just take the top slice. I get very frustrated when people say to me, I've looked on PubMed from 2010. And I point out that much of the good medicine was probably done in around early 1900s, 1920. And many young people said, well, that's so old. Yeah, it might be old, but the thinking was good. And one of the advantages looking back a bit is people didn't have sexy techniques, so they were forced to think. And because they were thinking, their papers became very much about the thinking that underlies the observations. Think about multiple search engines. Don't just use PubMed because it's there. I think PubMed, typically, we've just done some work for WHO, and I think PubMed picked up only 60% of the papers of interest in the treatment of severe malnutrition in childhood. Think of the grey literature, because that often tells you what matters to people. The grey literature is a sort of magazine type stuff or the in-house stuff, but it often helps you frame your thoughts. Then we can talk about reviews, original papers, and systematic reviews. If you've got these lots of ideas, and you'll always end up with lots of different things you could do, you've got to sift it down, and you need to ask around and get advice. That's the best thing we can say. Look at current trends. Look at what's happening now. Think about the technical and clinical advances that have taken place. Think of the clinical need. Thinking of the funders' need or their call. And on behalf of NIHR, can I say, please read the small print? Because very often people don't read the small print. And they have a great idea, it's just wrong for the call. And it's at the same, all funders want cutting edge stuff, world-class science, I think is the word we keep using. But at the same time, they're risk averse. So don't promise something you can't deliver, but be brave in what your promise is. Very often we've got a vague sort of idea of what we think the problem is. Go out there and get different perspectives on that problem. The only way you're going to take that melee, that mass, and synthesize it down is by taking different perspectives. It shouldn't just be about you and your colleagues. Go out there and ask people. PPIE, we believe, is critically important in helping you frame the question. Asking parents, families and carers, does it matter? Ask commissioners, does it matter? And it might be sexy science, but it might not have any impact because it's not relevant to the needs of the people we serve. And after that process, you probably will come down with a reasonably clear and succinct statement of the problem. And at that stage, you write that problem down. You're clear what the problem is in one side max, preferably a paragraph. Offer it to your granny. Does she get it? If she gets it, then you're in the right space. And the reason why I say this is so important was picked up by Paul Glazier and Ian Chalmers. Ian Chalmers, you may know from the Cochrane Reviews and from the James Lind Alliance. And Ian has been arguing for many years now about the waste in research. And Paul and Ian argue that something like 85% of the research that's conducted is wasted. And if you haven't read this, go and read it. And I'm not expecting you to pick all the slides up, but statements around low priority questions, important outcomes not assessed, clinicians and patients not involved in setting the research agendas, 50% of work never being published. So we have to prevent this from happening, and we do that by thinking about why we're doing what we're doing, how it's happening. And there are lots of different study designs we can apply, and the research question very much informs what type of design you're going to do. Is it about existence? Do neonates feel pain? You want to know because that's an important consideration. Is it about some descriptive? Is something that you see in one condition the same as something that you see in another condition? Conventional treatment versus some form of new or novel approach. Let me go through into causality. Now, the further we go down this line, the more complex it becomes. But it's very important you're clear what box you're operating in. Again, this principle about not conflating your thinking. And then you get to frame it. You've got this statement, this problem, and you've got a question you're trying to frame. And really, these are all the highs and whats and hows. And we'll give you a copy of this, so you've got it for your thinking if you're in the camp. But in essence, why is there a gap in the understanding? Is it that nobody's even looked at it? Is it because it's been looked at and it's equivocal? Some say yes, some say no. But actually try and think about what the nature of the gap is and why there is a gap. Ask the question, why now? Why you? What do you bring to that? Think about what you're going to do. What is it that you're actually going to do in this research? Think about the resources that you need. Ask yourself, how will this research address the question? Be prepared to refute your own ideas. Challenge them. What's the research going to find out? What's the risk of it finding out? Nothing. Is it worth finding out? Or is it just another piece of things? I don't know about you, but my PhD is still sitting on my mum's shelf. That pride of place alongside the photograph. Is it really worth it more than to my mum? And what would the impact of your findings be? And then you start getting this idea and framing it, and then you end up with some form of research question. And there are different approaches. This is the Pico format: population, who you're looking at; intervention, what are you looking at; comparison, compared to what; outcome, what's the specific measure. And please can I emphasize the thing known as a primary outcome. Not 100 outcomes, a primary outcome. And then you've got the time frame, when or over what period of time. Be clear about the aims, hypothesis and objectives. And be clear that they're different. And people often in their applications conflate the issues, conflate their thinking, leave their logic behind. Lack of precision in the use of the terms. The aim is the overall purpose. The hypothesis is a belief. Back to Socrates, it was a thesis that you test, part of which is a hypothesis. Think about the objectives. How will you test the hypothesis? How will you know if it's correct? And if you've only got one primary outcome, it's possible then to say, well, what sort of numbers do I need to answer that question with this outcome variable? And that comes back to previous literature to try and power your study. But be clear when it's a primary objective and when it's a secondary objective. Very often research questions are very explorative. Well, that's very hard to see where your explorative thinking is going. Your research questions and hypotheses should be made as specific as possible. Avoid words or terms that don't add anything to the meaning. Very often I take a red pen to somebody's research question and remove about a third of the words. They're not necessary. They don't explain anything. They get in the way of the thinking. Avoid terms such as, I'm going to prove something. Well, good luck there. Okay. Don't shoot yourself down before you've even started. You might contribute to something, but it's very unlikely you're going to prove something. And please be clear when you talk about significant. Is it clinically significant? Is it statistically significant? What do you mean by the word significant to whom is a key statement. Stick to what will be studied, not the implications. This may transform medical care. I even had one recently who told me in a mock interview that she was going to get NICE to change their mind by her little study. You know, get real. And avoid using two different terms to refer to the same variable. Often when you go through and it's been written by a committee or different people have put their tuppence worth in, you often get words in there that don't actually match. You start talking about a variable and a parameter. Please, it's not necessary. It just confuses the reader, shows a lack of precision. There are ways of evaluating the research question, and there's something known as FINA or FINA maps. It comes in two parts. Is the research feasible? Is it interesting? I always find that a fascinating question. Is it interesting? Interesting to whom? Now, if you're taking something that the James Lind Alliance and patients and clinicians said, this is the most important thing we need to solve now, I would substitute important for interesting. But it is interesting because it's going to make a difference to these people. Is it novel? Is it ethical? Is it relevant? That's finer. And equally, you can talk about, is it manageable? Can you actually deliver this in practice? Is it appropriate? Is the design appropriate for the question? Is it really going to have any value? And systematic is I don't like systematic. It means that there is a system applied to your thinking. I think I would call that logic. But finer map doesn't work well as an acronym. So for words systematic, please use logical. When we look at grant applications, these are the sorts of questions that we're asking. Some funders actually make you do a finer maps type analysis and actually state what your views are in each of these topic areas, but you should have done it before the reviewer does it. There are all sorts of questions or problems that arise. There are problems associated with a research question being too broad. Narrow the question, reduce the number of variables. If it's focused, it's more likely to be achievable. If it requires 100 different things to be measured, why? What are the 99 other things going to add apart from your key thing that you're interested in? Not enough subjects, and this is taken from quite a nice paper in the Journal of Indian Association of Paediatric Surgeons. How's that for an obscure source? But it's actually quite a nice paper, the way they've written it, about thinking and phrasing your questions. Not enough subjects. Expand the inclusion criteria, or reduce or modify the exclusion criteria. Be careful. If in doing that you're introducing confounders, it gets difficult. The whole art of a good question is reducing the confounders so the question can be answered directly. I think the usual way around it is lengthen the duration, but that usually runs into the problem of the funder. They'll only fund you for 3 years, but it's going to take you 7 years to complete. Or add other centres or sources of patients into that activity. It's too expensive, very often is the criticism. Well, why? Is it because you're measuring too many things, or you're measuring an unnecessarily large group of people? Think about less expensive measures, fewer follow-ups. You still have to fit within remit or within budget. Lack the expertise. Well, sometimes it's hard to acquire the skills, but it's always possible to collaborate. And collaboration is the name of the game. And many years back now, I think I introduced the idea of sharing seamlessly and stealing shamelessly. But you can only do that if it's cooperative and collaborative. You're working with each other, and if you haven't got the skills, go and find somebody who has and work with them. Not relevant? Well, that's largely because you haven't read the small print. The calls are very often very clear, or the instructions are very clear, and it says it's not relevant, it's because you haven't read it. If you'd read it, you'd realise that. Or ask your granny if she thinks it's relevant. Go to an alternative funder. Other funders are available. Not as good, but other funders are available. So is that all right? Just checking with boss. But the point about it is sometimes the project you have or the question you want to have answered isn't fit for the funder. Don't be afraid. And please try and get out of the habit of writing an application for a funder, for a call. What you tend to do there is you actually are answering a different question to the one you're really interested in. Be clear about what the questions you're interested in are now, not waiting for a call to come out that specifically matches your question. If you're clear what your things are you want to do, most funders have open investigator calls. You're not relying on something which is targeted. If it's deemed not interesting, think again. I come back to thinking. There's all sorts of ways. I can just illustrate this in some of the ones that have been going on in my group recently. I'm interested in cancer. I'm interested in how poor nutrition puts you at risk of surgery in cancer or risk in relation to the systemic anti-cancer therapies. So somebody said, oh, what's the prevalence of disease-related malnutrition caused by the disease in cancer? Is that a good research question? Think about it. Is that a good question? I hate the word good, but is that an effective question? Well, it's very clear at one level, but it's very ambiguous at another. Which cancer? What stage of cancer? And what you're going to end up with is a number. What are you going to do with a number when you get a number? So let me offer you another one. Another member of our group says, oh, I want to know, well, what causes disease-related malnutrition in patients with colorectal cancer at diagnosis? Is that better? Is it a little clearer as a research question? Well, we've got the defined group, we've got the time point, and we've got the thing we're interested in, but it's still a very descriptive study. And here's a third one. This is a good example of something we are now doing, but it's what is the impact of early preoperative oral nutrition support on perioperative complications in patients with colorectal cancer versus oral nutrition supplements after surgery. Can you see how we've evolved the complexity of the question? It's not complicated, it's slightly more complex, but it actually spells out the population, the intervention. It spells out the outcome. It spells out, I've lost my train of thinking, and the timescale. Let's leave it there. Okay. But the point is you can see how you can evolve the research question. If we'd stopped at the first one, we wouldn't have actually made a difference to anybody other than to report as in a descriptive sense. And finally, I just want to bring you back to Aristotle. Now, I'm sure you've all seen this. If you haven't, go away and look at it. You can Google it. It's out there. My friends who are lawyers say this sits at the heart of being a lawyer. And if you were a lawyer, you'd know this inside and out. And Aristotle offered us up the three pillars of persuasion. And he called it a rhetorical triangle: logos, ethos, and pathos. And when you are in camp pitching on Thursday to the great and the good, make note, Dave, to tell your team.
Thanks, Steve.
To be clear about logic is at the top here. If it's not logical, it doesn't make sense. If it doesn't make sense, how can we support it? Is it credible, ethos? Okay. Can you deliver that? Can you meet the expectations that you're imposing? And finally, pathos, empathy. Think about the why you're doing what you're doing. And I put it to you, ladies and gentlemen, that you need to be able to offer a compelling, coherent argument. If it's not persuasive, whether it's a belief, whether it's a study, whether it's a thesis, it's very hard to see where it's going. So that's my route map for you. And whether you're here today in camp or whether you're at home, we're happy to share this. You're welcome to use it. It's not original. It's used as a set of principles in many different places. I've just tried to simplify it into these steps. If you're in camp, you're going to be asked to think about what's the area of interest that you want to address. You'll end up with lots of questions, so you're going to have to work together as a team to refine that down to one question. And the biggest challenge we have in camp is that there are, how many in the team? 7? 8 in a team? Is finding consensus within the team as to the question that you should address, the problem. And that's that first step. You're going to discuss it. You're going to refute it. You're going to thrash it out before you agree to do it. And that's why team working is so critical. So my take-homes. How you develop and frame your research question is critical. I think it's the most important part of any research study, any thesis, any grant application. And it's an art form, like all good things. It takes time to refine it and to practice and get good at it. But the better you are at it, the more likely you are to succeed. It can be difficult, it is time consuming, but invest that time and effort at the beginning to get clarity of thought. Back to logic first, please. A project can fail, or a grant application will fail, if it's not sufficiently clear what it is you're trying to do. It's unfocused, poorly defined research question. I argue that taking a systematic, inquiring and critical approach to developing your research question is the way. A hypothesis or objectives will better enable a successful research project. It will influence the interpretation, the inference, and the application of the findings. It will also affect the likely success of any grant application this week or any future grant application that you have. And if you become known as somebody who can communicate effectively, clearly, logically, in a way that everybody understands, even your granny, then there's a very good chance you'll persuade people. Thank you.
Brilliant. Thanks, Steve. Incredibly relevant, not just for today's activities, for the delegates at home. And Karen, do we have questions?
We do. Okay, so somebody's asked, qualitative research doesn't use hypothesis usually. Would research questions use the same techniques?
I think for qualitative research, very often we rely on research questions, but the research question is just as valid as a hypothesis. But I still think even in qualitative research, you need a belief structure that underpins it. And it might not be expressed as a hypothesis, but there's still a belief there that you're trying to understand and unpack.
And then another question to say, are there many funders for qualitative research?
I believe there are. I believe there's one, NIHR. I think they do a bit of qualitative. I mean, there are lots of funders for qualitative research, and I think one of the challenges to me, I mainly work in experimental medicine, but many of my colleagues are working qualitatively. And if you're going near patient work, that qualitative element or mixed methods element is key. And without that understanding, and for those of you who don't do qualitative research, please go and learn something about qualitative research. It will change your thinking and may actually introduce something to your work that you hadn't previously considered. And very often grants get rejected because really it should be a mixed methods approach. And you've taken a very narrow approach because you want to do an RCT.
Okay, one more.
I was just going to say, when we had a look at the subject areas, I think mixed methodology was by far the greatest in personal fellowships. It was by far the greatest category, so that mixed method is very well much supported by NIHR.
And if I just finish on that, I mean, it's about finding out. It's the thinking bit. It's not how you do it, but it's the thinking bit that matters.
Okay, this is an interesting one.
Oh, gosh.
When do you generate your best research ideas? Do you dedicate some thinking time, or does it just come to you?
A lovely question. If I'm honest, I'd say some of the best research ideas have taken place at conference, in the bar, afterwards, when everybody's very relaxed. You've been shown a poster or you've shared some work, and then somebody comes up to you and says, have you thought about something? It's not you imposing your ideas, it's people coming to you and saying, I like what you're thinking, but have you thought about this? And you go, no, I haven't thought about this. And very often, to me, they've always been the best ideas. Not that I'm devoid of the ideas, but I think that challenging you to think is at the key. Sorry for being repetitive in the message.
Brilliant. And can I say, I think trying to meet up virtually really makes that kind of creative process difficult.
It is, and that's why for you here at camp, congratulations, you'll have the chance to sit in the bar and ask lots of questions. Remember, Waldgett's in the chair, Dave. We did have that written down and recorded. But the point is, for those of you at home, even it is difficult to share your thinking if you're sitting in your office or your room or whatever. But please make the effort to do so, even now in these times where we are restricted. I think, academically, I think that's been the biggest challenge of these last 18 months. That natural spontaneous thinking and thought development has been constrained because we all sit in separate spaces. And it's that ability to put your heads down together over a piece of data or a paper. It's that ability to hear other people's thinking is what brings you forward as an individual and as a professional group.
Thank you.